Intuitive Surgical is a company that provides products and services for surgeons in minimally invasive surgery. And we use advanced technologies to do that. So robotic assistance, intelligent systems, advanced imaging. As you think about surgery as a whole, the goal is to provide benefit for the patient, a cure or mitigation of disease, and to disrupt the patient's normal life as little as possible. So progression has happened over time from traditional open techniques that require large incisions to clinicians developing something called laparoscopy. Our product is a continuation of that thought process, which is to allow small incisions and high precision interactions, but to use some advanced technologies to give them a lot of precision and control that can allow them greater access relative to open surgery and greater precision and comfort relative to laparoscopy.
When I first started using the Da Vinci platform, the most striking difference was the three-dimensional view. The other things that were first intriguing were that in laparoscopic, the instruments that you used didn't articulate, they just opened and closed, and your limitation is using two hands. With the robotic platform, even in its S form, you were able to use actually four hands. Over the course of the time that I've been using it, as it evolved from the S to the SI to the XI platform, I think the biggest difference is the boom. The boom allows you to do multi-quadrant surgery without moving the stationary portion of the robot. So it has 360 degrees of freedom.
I don't think patients particularly care about robotics or not. That isn't important to them. What's important is what's the likelihood that I'm going to have a good outcome, and then how long is the recovery process, and how difficult is it? And this is what surgeons have been focused on and care teams are focused on. And we're focused on enabling them to get where they need to go.
I know that my father had the same surgery 15 years ago, and they cut him from his sternum to his pubic bone, peeled him open and took everything out and put it all back. So his recovery time was much, much longer. I was able to go home within 4 days of the surgery.
I think the growth is exponential. In a hospital, if your average length of stay is 3.1 and you take that down to 2.1, that saves that hospital, never mind the health system where we have 20 hospitals, $1 million. And with the patients getting home earlier and having a better patient satisfaction level, I think overall it's cost effective.
I don't worry so much about the entry of other companies. I think it validates what we've believed for many years, and that is that these technologies and these approaches really matter. The encouragement of other companies entering is really by our customer base, who say these things are important, and if you want to participate in the future of surgery, you're going to need to be here. And I think that's good for us because we've known it. And so I worry a lot less about what the competitors are doing. I worry a lot more about what we're doing and how well we understand the needs of our customer base. And if we take care of that and take care of them, then I think the company will do well.